So my name is Dr. Mbuvi. I am a medical officer working at the Kenyatta National Hospital. I think the beauty about being in KNH was that they were able to quickly, we had a COVID theater. So we had a theater that was specifically dedicated to handling any surgical cases for patients who are COVID-19. And I think that was, it's one of those things that you sit back and you look at it and you go like, yeah, that's a brilliant idea. And even the doctors were working. So it was not only now an infectious disease unit illness, COVID-19, it not only belonged to the infectious disease people, because now we had to incorporate all these other people. We had to talk to the surgeons when they were going to do their surgeries for the patients who had COVID-19. The surgeons also had to come and review those patients who surgery had been done and they have been admitted into the COVID-19 unit because they have COVID-19. The surgeons have to come in, keep their daily reviews in terms of the surgical aspect of it, while we take care of the COVID-19 aspect of it. We still had our critical care specialists who are now the ones who are helping us in terms of handling these cases, the patients who we have in the ICU. We had a good team of pulmonologists, specialist doctors for lung conditions who are there with us, and they will actually, give us the step-by-step of how we're going to sort out these illnesses for these patients. What do we need to do? And the coordination all the way to, let's say, like the radiology department for patients who required chest x-rays or required chest CT scans to see how badly off they are. We had a system for them that they will actually go, and the radiology unit will be prepared. There will be guys ready for fumigation. So once the patient has, the scan has been done and they're heading back to our unit, the fumigation team comes in, they fumigate the area, give it time for it to dry up and settle, and then the rest of the system continues. Yes, it presented a challenge. Yes, there were many interruptions at that time, because of course if a unit has to be sort of like stopped for a COVID-19 patient to be sorted out, and then it has to be fumigated and then now continue again, of course there's time that is lost in between. But at that time there's really nothing much we could do, and we were just trying our best to see how do we still give the quality of care that KNH is known for to these patients without, in as much as we might inconvenience others, but even for them to understand that we are now dealing with a pandemic. And the good thing about, the thing about COVID-19 was that it was not discriminatory. It will not decide, today I'm picking him, I'm not going to deal with you, I'm going to jump to another person. As it was affecting everyone equally. So even the patients who are coming in, even the measures that were put in place in the hospital in regards to reducing the number of visitors who are coming in to see patients, people actually took it well, because they understood that the mandate of the hospital is to ensure the protection of the patient, to ensure the protection of the healthcare workers who are working here, and also you who is coming to visit your relative or your person who's admitted, we also care about your safety. So in as much as we were telling you that we were only allowing maybe one person to come and visit, or two people at most, I think a good number of the people who used to come and see their patients actually understood, and they knew why we were doing that. And also the same thing, our communications team did a very good job in letting them know this is the reason why we're actually putting these measures in place, because we want to ensure our patients are protected, our healthcare workers are protected, and you as well as the visitor, you're also protected. That was the interesting thing about it. So when you're looking at that aspect of how we helped the patients who had COVID-19, KNH did its part. But then now we come to the area of what KNH did for its own people, its own healthcare workers, because even healthcare workers were not immune to COVID-19. So at some point, as we were going through the daily challenges of COVID-19, healthcare workers started getting affected. So now we had people getting affected, and not necessarily people who are working in the COVID unit, but even people who work in other areas of the hospital. Because you leave the hospital, you go to your home. You'll meet people on the matatu on your way home, or you'll bump into people in the supermarket when you're buying new things. Someone will sneeze, will cough, you get COVID-19. So now we started getting healthcare workers who had COVID-19. So now it became, okay, so this is an interest, this is something new. So what do we do to ensure that we take care of our healthcare workers properly? So the first thing that was done, there's a building next to our accident emergency department. It's called daycare center. So the daycare center was now fully, equipment was taken in, beds were taken in, and then it was designated as the healthcare workers isolation center, because we did not want to mix our healthcare workers with other patients who we were seeing. So at least we wanted to have that demarcation between the two and look at ways how we can be able to work on both sides. So the daycare center was opened up, and now we started admitting healthcare workers, and not only healthcare workers who work in KNH, but even healthcare workers from within Nairobi and I think also Kiambu County as well. We used to get healthcare workers who were brought in for isolation purposes, and even if they needed any other medical management or any other interventions that were required, the hospital took care of it. So now we had that unit where now we were taking care of our healthcare workers. And as luck would have it, I was moved from the intensive care unit and taken to the daycare center, where now my primary mandate was now to take care of our healthcare workers. And for me, honestly, I think that was one of the absolute joys of working in the COVID unit at that time, because now I was able to give back to the people who are actually on the front line, the people who actually, we were in the trenches with them, and now I had the privilege of being the person, together with a team of other doctors and nurses, to take care of them. And we were able to look at the protocols that were being developed at that time for now, how do we quarantine or how do you isolate people who have COVID-19? What are the parameters? How long do you need to keep them in hospital? After how long do you test them? How many tests do you require? Because from the time COVID-19 started in 2020 all the way till, I think towards the end of 2022, on the end of 2022 there, the protocols kept changing. Initially, it was you get isolated, we do a COVID-19 test, the first one, which comes out negative, you stay with us for another 48 hours, we do a second one, and then if the second one is negative, we discharge you home, but you go home at least maybe for about, I think it was about 14 or 21 days of home isolation, and then slowly you can now integrate back into the community. And with time, it changed as COVID continued to evolve. Those parameters changed to a point where now we got to a point where it was just now the isolation was done. We only needed one test to confirm if you're negative, and you didn't have to go home for home quarantine. You could maybe just take a day or two off work, and then you can report back to work. So that was the other part of now working with the healthcare workers. And also now, specifically now for KNH, for our staff who are getting COVID-19 but did not require isolation, because at that time now the protocols are also changed on who can be isolated, who doesn't need isolation. So for the ones who did not need hospitalization. So for the ones who did need hospitalization, we actually opened up a day clinic for them. So they will come, I will see them, and we'll talk about what symptoms they're experiencing, how they're coping with the medications. And most of the time, the medications that we will give are just basically for symptomatic management. You know, if they have headache, if they have joint pains, give them some painkillers, such things. And the other things that we were giving, like vitamin C and zinc. So we will give them that, and I will give them like now, a return date for them to come and see me, and then we will talk about how the experience is, and if they're ready to go back to work, we'll sign it off and they will be back to work. So that was also another part of the good thing about talking to healthcare workers at that time who were actually infected with COVID-19. And we worked at that place, kept the day clinic going on, and we would see our healthcare workers. And then a year down from now, around 2021, March 2021, because it was almost like a year exactly since the first case was identified, COVID-19 vaccines were now available. And that also became another game changer. And so at the place for daycare, we decided that's going to be also the place where we're going to be issuing out the COVID vaccines. And obviously, among the first people to be taken for the COVID vaccines were the people who were actually working in the COVID units, because we needed to have that first, and then the rest of the people in the hospital came in. And the uptake for the COVID-19 vaccine was actually quite impressive. We used to have long queues of healthcare workers, even just not from KNH, but even from different facilities who were coming to get the vaccination, because the vaccination was being provided for free by the government, which was actually a very good thing, if consider that we were dealing with the pandemic. And the vaccine also became a game changer, because now for us as the guys who are actually on the trenches, we were now like, okay, there's hope now. There's actually hope. Because we were always wondering, when is this thing going to end? Or is it not going to end? Are we always going to be in this perennial state of being in masks, ensuring that everything that you do is in line with protocols in terms of prevention, in terms of hand wash, in terms of hand hygiene, in terms of all these things? Is this life now? But now when the vaccines came in, it was such a good lifeline. It was hope. it was hope, and you were actually able to sit down and go like, whew, okay, now we actually we have something. We can actually start moving forward, and you can actually start looking forward to a point where we will no longer be in this perennial state of just fear and constant wondering of when is this thing going to end. Yeah, so the vaccine became a very good thing for us at that time, and it also helped that now, even as time went on, the number of cases also started going down. The government started loosening some of the restrictions like curfews and everything, and slowly by slowly we started seeing the country basically as a whole started slowly going back now to what they call the new normal, and being able to have lived through that experience from the very first case all the way, seeing how the different intricacies of how the healthcare system was really tested at that time, in looking at how we, as a healthcare system, how we were able to coordinate, not just as KNH as a hospital, but also with other facilities, and how as KNH we were able to help other facilities also, bring up the game in terms of how they're handling COVID-19. And one of those initiatives, which was actually very, one of the good things in terms of knowledge sharing and capacity building, was that the KNH team from the research side started webinars, which used to happen every Friday. Used to happen every second Friday. Actually, every 2 weeks on a Friday, we will have a webinar where, as KNH, we will present what currently are we doing in terms of taking care of patients of COVID-19. What are the new things that we are trying? What are the different things that we are trying? And slowly by slowly, this webinar started involving now people from the Ministry of Health, started involving counties, started involving other private hospitals, and people would actually come and they'll give a presentation. Let's say, like, for example, Kisumu County will come and give their example. They'll say, yeah, these are the number of patients that we have seen. This is how these patients are presenting. These are the main symptoms. This is how we are managing them. These are the innovations that we have come up with as a county that help us in terms of managing these patients. And someone from Mombasa County will give a presentation on the same, and they will say how COVID-19 is affecting a particular sub-county in Mombasa, and what interventions is the county government together with the national government doing in order to just help mitigate the adverse effects or the adverse outcomes of COVID-19. It was such an interesting place of knowledge sharing, because it had everyone from our senior consultants in infectious diseases to other consultants in other fields of medicine and surgery, and also now our regular people, our medical officers, our nurses, our clinical officers, anyone who at any given time was handling a patient on COVID-19 would be able to join into the webinar and actually just, pick up some bits and pieces of knowledge, know what to do, look at the new things that are coming up. And one of the things that really excited me at one point was at our Mbagathi facility, we realized that the patients who we had in there, because they were being quarantined for some even for more than 2 weeks, some even for a month, and because of the strictness of the measures, they had to be kept inside the ward. But we noticed that the more we kept keeping them inside the ward, and these were normal people, they were healthy to some extent, it's only that they had COVID-19, they just needed isolation. But if you keep them locked in one place, it also affects their mental status. And one day we organized for a Zumba class for them, and they're actually able to now come out of the facility just to the grounds of the facility, and they're able to do exercises and just interact with one another, dance, do a bit of exercise with the instructors and things like that. And from that, we actually noticed that by giving them a chance to actually be outside of the ward, to be actually outside and actually, enjoy the fresh air, breathe in the air, sit outside, bask in the sun for a bit, and allowing them that space to at least, if I can put it like, stretch their legs, was actually a very big impact for them. Because some of them were actually saying, I've been inside this ward for a very big period of time. I just want to go outside and just feel the sun on my skin. Just allow me to carry my seat and just sit outside there and just take a breather, enjoy the air, enjoy the sun, and all these things. And it was nice. It was good to see that. And as a doctor, personally, it also, like I said, it showed me the aspect of how important our mental health is, not just for personal, but even for people who have illnesses and things like that. So for people who have illnesses and things like that, but even for people who do not have any illnesses, because as part of the WHO classification of what health is, mental health is actually a part of it. It says that it's not merely the absence of disease, but it's also your well-being in terms of your mental health, your physical health, and your emotional health. So that's what we call health, as in good health in general. So we were taking care of their physical health, but then now we understood that now we also need to put in the aspects of your mental health. You need to look at how well are you coping with this disease? How are you going to cope once you have left the facility? Because if we go back to the people that we had in the facility, many of them lost their jobs. Many of them lost their houses, because some of them will stay there for a period of maybe a month, 2 months. They have not paid rent where they were. They do not have an income they can't generate an income when they're inside the facility. So they can't have money to pay outside. So there were so many challenges at that time for those people, for the patient that we took care of there. And one of the things I think that was a major win for KNH is the fact that the treatment for COVID-19 was absolutely free. None of those patients were actually charged. So everyone we will treat, we will give you medication. Once you've become better, we have done the tests, you're negative, we will discharge you home. You will not be asked to pay any amount of money. And even if you ended up in our ICU, you required even surgery and things like that, as long as it was COVID-19 related, the charges were not there. And that was, for me, another big win for KNH, because we were able not only just to take care of the patients we were seeing, not just for their physical health, but also help them in terms of their mental, and also to some extent their financial side of it, such that they did not have to think about raising money to pay a hospital bill, which probably would have been a significant amount of money. And most of the people who had actually been admitted there were not people who, some of them actually came from what I'll call low social economic status, so they will not be able to really afford, to be very hard for them to actually make the payments. But as KNH, we were able to offer services to them, and proper top-notch services for them, and we were able to discharge them, and they went home. And those are some of the small things that I consider to be our biggest victories as KNH in terms of how we were able to manage COVID-19, to the point where we kept improving on our workings, we kept improving on our infrastructure. So to a point where even KNH now actually acquired its own COVID-19 testing machine. We were now able to do the tests in-house, which also meant that we took a shorter time for us to get our results, rather than waiting for, let's say, the National Influenza Lab or maybe KEMRI to do the tests for us and bring for us back the results. So this also helped us in terms of reducing our turnaround time for the patients who we were with, even for the people who are just coming to be tested as outpatients. They will just come and just want to be tested. They're tested and they can get their results within 12 hours, 24 hours max. And it was actually a good thing for us. So from my experience of what we went through as a country and what we went through as a hospital, for me, it showed a side of humanity that is rarely seen. Okay, not rarely seen, but is not really seen that much in the healthcare space. We deal with conditions that have been there for a long time. The diabetes, the hypertension, the malaria. We know how to manage them. We know how to deal with them. We have protocols in place that have been effective, and they have run and they have done their work tremendously. But now, we were faced with a disease that no one knew how to handle, that we had to rely. We were looking at what China was doing. We're looking at what Europe was doing. We're looking at what US was doing. And then we realized that we also need to look at what can we as Kenya, what can we as Kenyatta National Hospital do in terms of management of COVID-19 in our country. Because even if you look at the statistics, and we thank God again, we did not lose as many people as the rest of the world, as the people in India, people in China, Italy, Spain. We did not lose that many people. So there was that thing of, okay, yeah, there must be something that we did right. There must be something that the government did right, in as much as people maybe protested a lot about the curfews and everything, and the mandate to wear masks throughout. But it actually, because as healthcare workers, we actually saw the effects of those things. The numbers actually went down when these measures were actually put in place, when there were stringent measures about how to put on a mask, hand washing, quarantine, reduced socializing. It actually helped to curb the spread of COVID-19. And that is just from personal experience, from what we saw, and in terms of our statistics at the hospital, in the number of patients that we will get. And when restrictions were eased a bit, there was usually a spike in the numbers of patients that we will get, and then the measures will be put back in place, and then the numbers will go down. Yeah. So that was basically those 2 years of, in summary, of working in the COVID-19 unit. Yeah. So COVID-19, the pandemic, taught me a lot about collaborations, taught me a lot about the importance of research, especially in the healthcare space. And the main thing I can say is that it taught me to actually relate with my healthcare worker colleagues, the people I work with in KNH, and not just to see them as my colleagues, just to see them as, this is a doctor that I work with, this is a nurse that I work with, but actually to understand that at some point we're almost like a family. As KNH, we're almost like a family, because if I'm not there to assist you and you're not there to assist me, probably we both fail. But COVID-19 showed us that we can actually work way better. We can actually do teamwork way better, and not just from the ground level, but also all the way from the board to the senior management, to the management of the hospital, and then out to the rest of us who were considered to be the foot soldiers at that time. And it also showed me that if you have, like I said, if you have the people who are propping you, the people who are supporting you from behind, the people who are holding your foundation, if you have a strong team that is doing that, your foundation is solid, there's nothing that you can't do. And I saw that firsthand from KNH, from the support that you got from the management, the support that you got from the Ministry of Health, from the government, in terms of just allowing us to do what we do best in terms of providing quality healthcare, was amazing. And being in the COVID-19 unit was also an inspiring thing for me as well. As a doctor, I'd never thought I'd find myself in a situation where I'll be dealing with a disease that would have so many aspects to it. But it was an excellent learning experience, and I believe it has actually shaped my medical career for the better, because I learned a lot during that time. And most of those lessons are lessons that I try to use on my day-to-day practice as I continue to practice as a medical doctor. Frontline colleagues that we worked with, wow. Honestly, the best team you could ever work with. I had a team of from the specialists to now my colleagues, the medical officers who we worked with. It was a big team, because we had several areas where we were handling COVID-19 cases, and we all came together under one umbrella under the infectious disease unit. And we had an amazing team, people who were dedicated. The doctors were very dedicated, the nurses as well. And I think there's some people who the spotlight never really shines on them a lot. We have the doctors, the nurses, the laboratory people who are handling the patients and doing the tests and everything. But there's a group that I believe, if it wasn't for them, our work would not have been as easy as it was. And this was, I'm talking about our support staff. The people who came in with us into the unit, they were responsible for cleaning the unit. They were responsible for disposal of the garbage, disposal of infectious materials. They were responsible for just ensuring that the environment that we were working in was actually top-notch. It was actually clean. It was up to standards in regards to public health measures. So those are the people, I think sometimes they tend to be forgotten, because everyone tends to look at the highlights, the doctors, the nurses, the lab techs and everyone. But we had an excellent team of public health and support staff, and even the people from the kitchen who used to bring food for us and even food for the patients. As in, it was such a collaborative effort that not one particular cadre can be given like full accolades and told that you are the guys who did the best. But we had such a big team that included so many people, and even not just from the clinical side, but even from the administrative side, because you need administrators to ensure that supplies are available. You need administrators to ensure that the equipment that you need is there, and you need security. You need security personnel to ensure your protection, to ensure the protection of the patients, to ensure that we do not get any attacks from outside or from within or from whatever. So all these people who worked in the COVID unit, everyone from the doctors to the support staff, in between with security, catering, all these people, I think had the best team. We had a really dedicated team of people who were working in that particular facility. Yeah. So mine is just to if they ever get to see this is just heartfelt from me. Thank you so much. You guys made us who we are. You guys pushed us and pushed KNH to levels that no one would have thought we will get to in terms of managing a pandemic. Yeah, and we did, and we thank you for that. We also appreciate the fact that the Ministry of Health and also the government at that time really saw the work that we did, and at some point we actually some of us were actually honored by the president to be given the Uzalendo Award for the work that we did, and many of my colleagues were within KNH who are part of the recipients, including myself, and it felt good to be recognized, it felt good to be appreciated, and so I'll just take that time to actually appreciate the other people who actually helped us to get to that level that we did. Yeah.